quote.
In 2019, the U.S. Census Bureau estimated that about 24% of North Dakota's population are children. The overall population estimation was, at that time, approximately 762,000.
That means there are more than 182,000 children in our state. So where are we going with these numbers? Becky Farr joins us now live to explain.
Nicholas and Lauren, for all of those kids, there's a very finite number of mental health resources. A Watford City School Resource Officer tells me that's especially true in the western part of the state, but the need is great. The Behavioral Health Division of the Department of Human Services works to find those gaps and fill them. And I do have a side note. Some of the video used in this story is KX News file from before 2020, which is why you may notice things like crowding, no masks, or social distancing.
The best comparison I would give is think about if the medical system only had emergency rooms.
That's Pamela Sagnes. Her job is basically to look into the future. The Behavioral Health Division exists to find ways to fix things, so to speak, so that 10 years from now, we're not having the same issues that are present today. Her comparison to emergency rooms has to do with the small number of mental health services across North Dakota, but also with the accessibility to those resources. Right now, the state is without a mental health provider registry or a bed management system. That means it can be hard to find what's available and where. And if you do find a provider, there's no way to really know its capacity other than waiting. That also means at any given time, the state can't keep track of needs or gaps in treatment options. That's where Senate Bill 2161 comes in. It would create the provider registry, which exists for addiction, by the way, and keep track of bed capacity. That bill is still in limbo. However, there have been major strides by the Behavioral Health Division, one being a Medicaid state plan amendment, which brings about new services. The amendment gives reimbursement incentives to providers to offer services, like family peer support, for example. The division is also working on getting early intervention services that the state currently lacks, like community and home-based services, so that kids can stay in the environments they're most comfortable in and potentially avoid unnecessary institutionalizing.
For the last couple of years, I have really been trying to figure out, how can we make improvements in the system that will be meaningful and, not just the Band-Aids, but true systemic change so that we can help people and help families.
Another stride is partnerships with schools, which Sergeant Jeff Jensen, Watford City Police Officer and School Resource Officer, says is much needed.
We need to make sure our teachers, who are one of our first lines of defense when it comes to identifying kids in need or kids in crisis, we need to give them more education, we need to give them more tools and more learning opportunities how to identify these students.
That need is being addressed in the state legislature right now. Senate Bill 2311 would require schools to give direct instruction to kids in grades 7 through 12 about how to identify warning signs and risk factors for suicide. Something that would be a step in the right direction as kids do struggle with anxiety, stress, and depression. And Jensen says kids just don't seem to have the necessary coping skills. Sergeant Jensen teaches DARE to all Watford City fifth graders. An element of the program is an anonymous question box.
A lot of them are fun questions. What are your favorite foods? How many dogs do you have? Do you have any kids? What's your favorite part of the job? Do you like going fast? But we get a lot of serious questions about what do I do if I feel suicidal? Or I have a lot of stress going on and I just don't feel right. Or how do I get my parents from stopping to drink every single day all night long?
This alarms him. And while teachers and staff are instructed to look for warning signs, as Sagnes says, those signs aren't always there.
Often people think those are students that are maybe struggling or identified already in the system, but it's often students who are not identified as needing behavioral health help. Sometimes it's, for example, the kids with silent symptoms.
And for teachers, educating is a lot more than ABCs and 1, 2, 3s.
Teaching is no longer just teaching reading, writing, and math and science. Teaching is teaching these kids how to cope, how to be good citizens, how to be good friends.
He tells me that in Watford City, there are only 2 counseling providers, and the school doesn't have a guidance counselor. Even if it did, it's a useful tool, but is by no means a solution to the problems at hand. Beyond that, there are only 6 publicly licensed psychiatric residential treatment facilities in the state. That makes for a total of 82 beds in a state of about 182,000 kids. The most recent numbers are from January 20th. Of those 82, only 5 were free. Hospitals may have inpatient programs as well, but under different licensure. Trinity Health has an 8-bed unit, for example. That's the closest facility for Watford City kids. But with 8 beds, Jensen says kids are going as far as Fargo, Jamestown, or even out of state. And it's not just Watford City youth. The 2019 Youth Risk Survey that's taken every 2 years shows that 10% of North Dakota students age 11 through 8th grade have tried to kill themselves. Jensen expects that number to be higher in this year's survey.
Last school year, we only had a handful of students that had mental health related issues as far as depression and suicide that we dealt with. And this year, that number has gone up exponentially. I've actually lost count so far this year with how many students that we have gotten to a mental health facility outside of Watford for a imminent risk of suicide or some type of self-harm.
One child is too many. One person is too many. From 2016 through 2020, Minot Police responded to 229 suicide calls. 31 lives were lost to suicide within those 5 years. Some would argue that it starts with our youth and that more needs to be done, which is why people like Jeff Jensen and Pamela Sagnes are advocating for change. So as I worked on this story, I also spoke with Nicole Cross-Hillman, a Sanford health psychologist, excuse me, who can attest to the experiences that Jensen has as a school resource officer. So here are some of the top contributors to mental health struggles that she sees. One is the pressure that kids are under, whether it be from school, families, and especially social media. COVID has also impacted kids quite a bit. She said the inability to be around friends and teachers can really hurt a child's development, especially for those where school is their safe space. Hillman says parents should look for any sign of function impairment. A child may act out or do the opposite. They may stop sharing as much or not at all, and they may lose interest in things that they were once excited about. Another thing that she had suggested is that parents outwardly ask their kids if they have had thoughts of suicide. Research shows that it's better to ask if they've ever thought about hurting themselves or if they maybe have friends who talk about it. So Nicholas and Lauren Hillman says that parents shouldn't be in fear of asking those hard questions with the notion that they'll put the idea in their kids' heads. Conversations together are better than not at all.
So true. Becky Farr reporting. Thank you so much.
Now to our COVID-19 North Dakota Watch. The health department reports